Hello, this is Dr. Ruby. Welcome to the lecture for Module 5, Chapter 8, Goal Setting and Behavioral Management. In this chapter, we'll talk about the strategies for success for older adults in activity. One of the first things that we'll talk about is two categories of their success. The first is the adoption, and the second is the adherence. So adoption, of course, is when the client begins the program, and adherence is, of course, their maintenance of the program. One thing to consider as we look at older adults is that 1/3 of the population that is 50 years old and older is sedentary. So we're really working with a population that typically is not active, and it is much more difficult to get them to start and then to get them to maintain the program. There are several personal characteristics that influence an older adult's exercise participation. We find that females, ethnic minority, older age, rural residents, and low socioeconomic status are things that make people less likely to participate. Other things such as health-related factors such as arthritis, pain, smokers, and obesity are other characteristics that we see that may cause them to not participate in exercise. Attitudes and knowledge can also take part in the ability of a client to participate. Many older adults have a fear of falling or of injury, and that this will keep them from trying an exercise program. Of course, just like younger people, the older people say they don't have time. Many of them are just not self-motivated, so they won't push themselves to try something or to maintain something. There are also several factors of an exercise program that will influence an older adult's participation. The structure, the format, the complexity, the intensity, and the convenience and financial and psychological costs of an exercise program will influence the older adult. Older adults prefer moderate intensity, they want it to be inexpensive, and they don't want competition. They prefer to be outside of a formal class or group setting, and the social factor is often a motivating factor for them. Environmental factors can also play a role. Social support from friends and family, and especially health professionals, is a positive influence. So if we can get their friends and their family to buy in, or their health professional to recommend exercise, we can often get a good start with our clients. Social support seems to be more valuable for women, so the females seem to need more family and friend support. Travel distance, climate and weather, safety, and available facilities all also play a role in the environmental factors of doing exercise or participating in an exercise program. There are several strategies for behavior change, and we can apply these to changing the behavior of participating in physical activity. The trans-theoretical model is very useful for understanding people's readiness and motivation for change, and it is comprised of 5 stages. First is the Precontemplation Stage. This is where the client does not yet perform the desired behavior and has no intention of doing so in the foreseeable future. The Contemplation Stage is where the client is thinking about adopting the desired behavior and maybe planning to adopt it within the next 6 months. The preparation phase is when the client plans to perform the desired behavior in the next month, but does not necessarily do it consistently. So we might do it 1 month, skip a month, and then come back to it again. Action is when the client performs the desired behavior consistently, but has been doing so for less than 6 months. Maintenance, on the other hand, is when the client has been performing the activity and has been consistently attending and participating for 6 months or more without faltering. One way that we have found that we can help older adults become more active is to work on increasing their self-efficacy. So to increase self-efficacy, Self-Efficacy, we can encourage realistic goals and provide proper instruction and demonstration of exercises. So if a client is coming in and telling you they're going to run a 5K when they've not even been running at all yet, it might be good to talk them down to a more realistic goal, something that might be more manageable so that they can be successful. And then we may want to provide some reference of how to do that activity effectively, maybe proper shoes, proper alignment, a place to run. These kinds of things can be really helpful in getting the person able to actually accomplish the task. Encourage your clients to try these things and express your confidence in their ability to do them, but also, in a sense, talk them down off the ledge and make sure that the goal is something that they could actually achieve. You can use other older adults that you know or that are working out with you as role models, and either have them talk with these clients or maybe talk about them to your other clients to let them know that it is possible at age 50 to begin activity, even if you've never done activity before. Most important is to provide appropriate instruction, supervision, and lots of reassurance. They may experience muscle soreness for the first time in their lives, and they really don't understand what that is. So reassuring them that it is something normal might be a good way to help them stick with the program. We have a few steps to help you to assist your clients in starting an active program. Step 1, we want to explore the expectations of the client. We want to use this time to get to know what the client is looking for, and then to decide if that is feasible. We want to discuss the expectations with the client and talk to them about how reasonable they are. We want to correct the client's misconceptions, preventing later disappointments that may cause them to drop out of the program.
So I call that woman back from the power company again. Now she's out.
Step 2, we want to set goals. We want to help to direct the client toward appropriate goals. The client must be primarily responsible for setting their own goals. We're just assisting, so we're not going to actually give them goals. They're going to make them up, and we're going to help them. The goals should be measurable, they should be realistic, and they should have behavioral outcomes. You want to set both short and long-term goals. Step 3 is we want to provide feedback and monitor the goals. So we want to regularly review the goals, both successes and struggles. We want to incorporate a behavioral analysis. So this includes antecedents and consequences. So these are things that you're praising them for, but also things that they're suffering or getting consequences for. We want to try to get the client to sign a behavioral contract that, yes, they're going to do this so often, and they've agreed to do this, and if they don't, we're going to have consequences. Step number 4 is to use rewards and incentives. So reinforcement has more impact than punishment. So when someone does not do the activity they say they will, we must reinforce them so that they can do it again rather than punishing them so that they'll be more likely to participate. Good things to do are to give incentives for class attendance or formal recognition. The client that attends every class during the month gets a t-shirt or gets an award on the website. Just ways to sort of reward them for their participation. Step number 5, we want to use problem solving to overcome obstacles. So if there's a barrier, we want to try to assist in finding a solution. If the client is, tender on the bottom of their feet, maybe they need a more padded shoe. Maybe the kneeling exercises are bothering them, so we might need to change them so they're not kneeling, but they're doing a similar exercise. We want to use discussion and make suggestions. Modification is key to keep these people participating. Step number 6 is to promote long-term adherence. So when you start an exercise program, whether you're an older adult or a younger person, lapses and relapses are inevitable. Adherence tends to be better after 6 months of participation. And we want to try not to use the all or nothing thinking. With the client, if they get some done, let's say they're going to do their exercise program 3 times a week, well, they managed it twice this week. It's not the end of the world if they don't get that third day in, and they really need to be patient with themselves and work their way up to that. Or let's say they had a family emergency and they had to take a whole week off. Well, these things happen. You get back on it and you try again. It's going to be a constant up and down, and we need to explain this to our clients and let them know that it's okay. This concludes the lecture for Chapter 8.